Hi guys, so today we have our patient. We are actually going to be doing her second Kybella treatment for her under chin. What Kybella is basically it melts away the fat cells permanently. The acid is a mimic of what we already have in our body, but as we inject the Kybella and throughout the procedure, we're targeting specific areas and melting away the parts that we want to be gone. The treatment takes 2 to 3 vials 2 to 3 times, and it's 6 to 8 weeks apart. We're going to be tattooing basically, as we did when we were like kids with those little water tattoos, the area that we're going to be treating for the patient. So these are red and blue little marks that help us remember where to and to not inject and to not lose our place. You okay?
Mm-hmm.
Now we just wait a little bit until our little dots come off onto the skin, and then we wipe away where we don't treat. I like to take this off very slowly because they tend to come off on the sheet sometimes. There we go. Okay, tilt your chin in. Perfect. So we're actually going to treat all the areas except up here because the patient does have a nerve there and we don't want to hit the nerve. I'm going to wipe off. Perfect. Okay. Good. You're okay? So I usually start right at the center where the most is, and then I kind of taper off into the corners. I like to grab, pinch, and inject. I don't put it directly into the dots just to keep the area sterile, so I go right next to the dots. You okay?
Mm-hmm.
So this is most of where our product is going to go. The depth of the needle is the most important part with Kybella. You okay?
Mm-hmm.
You let me know when you need a break, okay? This is why I use our dots, because it's easier to find. Push your neck down. Perfect. We're good in this area. So now we're going to move into here. So with Kybella, you can't go too deep because you don't want to miss the fatty tissue. And you can't go too superficial because you don't want to cause any ulcers. You have to be in the right depth. Moving on to our last few drops. Okay, that's it. You okay?
Mm-hmm.
You feel it, huh?
A little bit.
She's like a tough cookie. She's like, oh, it wasn't that bad at all.
You just feel like your jaw's a little bit tense.
Yeah. We're just cleaning everything up, keeping it nice and clean. That redness is not uncommon. Swelling means it's working. And what I like to do for all my patients is I always like to massage and blend it out for them. I do think that's a very important part, and I tell them to go home and do it themselves as well. Today may feel a little tender, but starting tomorrow, if they can, to massage it with the ice. I'm gonna take this. You okay?
Mm-hmm.
Let me know if I'm pushing too hard, okay? Is it cooling down a bit?
Mm-hmm.
Okay.
The first time I had it, it was kind of like a stinging feeling. I didn't get that this time around.
You're gonna feel burning. Do you feel that burning feeling?
Not
That
really.
heated?
It does feel a little warm, but it doesn't quite sting the way that it did last time.
Good. Each time it's going to be much different for you. Your next time is going to be much easier than this time. And we did 2 vials, so you're a trooper. If you with 2 vials, you're doing good. And for you, you know, you barely feel anything. You make me not get scared.
Well, I think it's because I feel like when they tell you, you know, what to prepare for, they tell you to prepare worse than what it's going to be. So when it actually happens, you're like, oh, that
It's not
wasn't
as
nearly
bad.
as bad as I thought it would be.
Well, that's good.